Glidden here, calling in from the great state of Montana. I am in Missoula, Montana, right now, preparing to give a lecture here tonight at the Doubletree Riverside Inn in Missoula, Montana, starting at 7 o'clock Mountain Time. That's the Doubletree Riverside Inn in Missoula, Montana. And if my signal seems a little funky, it's because we're broadcasting over a phone line today, and we're just going to have to soldier on and make the most of it. So I apologize in advance if the signal isn't up to snuff. We're attempting to work this out here. But the internet connection that I have here isn't the greatest in the world, so we're just going to have to soldier on, do the best that we can. I am on evening day two of a four-day tour. We're going to all around Montana. Tomorrow night we're going to be somewhere else. We're going to end up the tour in Bozeman, Montana on Thursday. Last night we were up in Kalispell, Montana, spoke to 75 people in Kalispell, Montana, and it was fantastic. We started at 7 and we didn't get out of there until 11. Why do people sit for 4 hours? By the way, we had breaks. You know, I'm not a Nazi. We give people bathroom breaks. Why do people sit through 4 hours of lecturing? Because everybody is sick, everybody is suffering, everybody is in the weeds, everybody is looking for help, everybody is frustrated with conventional medicine, but nobody knows what to do. And everybody tries to figure it out by themselves, and they can't do it because who has the ability to do that? Well, this is where my profession comes in. This is where we come to the rescue. This is what we are about. Our underlying fundamental message here is that healing is easy. Surgery is complicated. Healing is easy. And that you don't need a doctor's visit to help your body, to support and promote your body's ability to regain its health in the face of most chronic diseases. Healing is easy. You don't need complicated lab work. You don't need sophisticated MRIs and CT scans. You don't need that. All that you need is to stop eating the food that's hurting your body, supply your body with the 90 essential nutrients appropriate for your body weight that it needs, with a couple of extra add-ons, depending on what part of your body is suffering the most. Do that for 90 days, and most of the time, that's all that's necessary to get you started on the comeback trail, and the rest is just time. Because your body knows how to fix itself. Your body wants to fix itself. You don't have high blood pressure because you have a hydrochlorothiazide deficiency. You don't have heartburn because you have a Prilosec deficiency. You're not depressed because you have a Prozac deficiency. And you don't get arthritis because you're getting older. All of these things happen because your body has run out of the essential nutrients that it needs to maintain its health. It's that simple. So we have boilerplate, science-based, clinically verified methodologies to help you recover your health regardless of what your diagnosis is. If you're sick and tired of being sick and tired, you have come to exactly the right place. I'm going to go to the phones here in just a second, but an interesting question came up last night. I get this a lot, and it's worthwhile mentioning and chatting about for a moment here. 21-year-old kid raised his hand last night and said, Dr. Glidden, if what you're saying is true, why doesn't everybody know this? And that's a good question on its face. And, you know, I kind of expect something like that from someone, you know, in their 20s. They don't really have a lot of experience in the world. And there's a certain amount of naivete that goes along with youth, right? Well, the reason that nobody knows about this, and very few people do, is because what we're talking about is science-based medical nutrition. Now, MDs who own the medical theater in the United States, who monopolize the medical theater in the United States, are not trained, have no experience, no appreciation, and no respect for medical nutrition. So even though everything that we do is, in fact, science-based and clinically verified, the MDs have no experience with this. And because they have no experience with it, they don't know it, nor do they care to know it. I can't tell you how many patients I've had who were come to my office. They had come to my office because they were tired of conventional medicine. You know, they had arthritis. They're tired of the prednisone. They were tired of the painkillers. They were tired of the knee replacement surgeries. After the third knee replacement surgery, you know, they said enough is enough. So they come to me instead, and we fix the problem. And then they go back to their MD. The problem's fixed, you know, in 6 months after the MD had been hacking away at it for 10 years. And you would think that the medical professional, having devoted their life to helping to end human suffering, would pause, remark that, son of a gun, that's one of the most amazing things I've ever seen. I didn't know you could fix the problem like this, but there's a licensed physician right down the street from me who fixed it. I should give them a call and find out what they did, right? I mean, wouldn't you do that? Well, guess what? You know how many of those phone calls I've gotten from MDs in 20 years of clinical work? None. Zero. And this is why what we talk about is not part of the popular culture. We are way ahead of our time. Actually, we are 100% in sync with our time. It's everybody else who is out of step and on the wrong side of history. We are at the crest of the wave. We are the leading edge of new fashion, science-based, clinically verified medical nutrition. And because the contemporary medical monopoly doesn't want anything to do with us, that's why what we know isn't popular knowledge. And that is also why my colleague, Dr. Wallach, the founder of the Longevity Company, had the wisdom and the foresight to set his company up as a network business. Why? Well, because the pharmaceutical companies own medicine. They're the ones that call the shot. They own the medical theater in the free world. Because they have such power and such money and such control, instead of trying to fight them, instead of trying to enroll them in our way, which is a fool's errand, we're doing a workaround. We are giving lectures all over the country, all over the world, quite frankly. Dr. Wallach's going to Australia soon. I'm going to be in Trinidad. We're in Canada all the time. We're all over the place all the time, all over the United States, spreading our gospel of health recovery through medical nutrition and generating a grassroots coalition. We are encouraging you to get on board with our protocols. And when you experience relief from our protocols, we're then encouraging you to tell as many people as you can about them. And we will pay you to do it. This is our mission. We are here to change the way that medicine is delivered in the United States. 20 years from now, everything's going to be different because at least half of the people in this country will be on board with what we do, and that's going to change everything. So give us a call, ladies and gentlemen. If you'd like to talk to me today, it's 866-582-9933. That's 866-582-9933. And let's see what we can do to help you right now today. Let's go right now to the phone. I think Mary is up, calling from Vermont with a question about allergies. Hello, Mary. Welcome aboard. You are live.
Hi, Dr. Glidden. Awesome to hear you, as always. I have a 13-month-old grandson, and he is a gluten-free baby. He has been nursed pretty much exclusively up until, I don't know, maybe 4 or 5 months ago. And, you know, he started on avocado and, you know, some other simple vegetables and this and that. He loves salmon, but he's also now with goat's milk. Mom is still nursing him a little bit, but he's got some allergy stuff going on. Yogurt makes his tummy break out, avocados, eggs, and he's, you know, a healthy 23 pounds, but he's definitely got some issues going on.
Well, this raises an interesting conversation, and, you know, one of the things that we do is we bust myths, and we are an equal opportunity myth buster because there exists a handful of myths in the holistic world, as, you know, there do in contemporary pharmaceutical modern American medicine world. Now, I'm going to bet you 25 cents that his mother, who was nursing him, was not gluten-free. Is that right?
When she carried him, I would say no.
Okay. So what about now, since she's been nursing him?
Yes.
Has she been gluten-free from the very first day that she nursed him?
I'm going to say no because I don't know that she was. I'm going to say no.
Yeah, okay. So this is the thing, right? From our point of view, food allergies are generated by a funky small intestine. And, you know, you develop a syndrome that naturopathic doctors refer to as leaky gut. And when you have a leaky gut, big molecules of food can slip into the bloodstream where only little molecules of food should be. And when you get a big molecule of food in the bloodstream, it elicits an immune response. So, you know, what causes the leaks in the gut? Well, consistent consumption of wheat, barley, rye, and oats. Now, if the mother was eating wheat, barley, rye, and oats for, 25, 30 years before she got pregnant, her intestinal tract has all of these holes in it. It's leaky. And when she stops eating gluten, the leaks are going to persist. It takes the body years to plug those holes. The body will fix it over time, but it's going to take more than a couple of weeks and more than a couple of months. So, ironically, because she was eating gluten for, most of her life before she got pregnant, her body was loaded with allergens to food which she passed the baby through the breast milk. So irony of ironies, that's why the child is developing allergies now, because the mother was not gluten-free in her life before pregnancy. Now, so what do you do? Well, there's nothing you can do. Everybody's gluten-free now, and that's an excellent thing. So the best thing you can do for the child is put the child on the 90 essential nutrients appropriate for their body weight, and identify the foods that the child's allergic to and just eliminate them from the diet for about 9 months to a year. Just completely eliminate them. And then a year from now, give the foods back, and the allergy will probably be gone. Hallelujah, and pass the hat. We can help, and thank God they're gluten-free now. Coming up against the hard break. Ladies and gentlemen, I'm Dr. Peter Glidden, live from Montana. This is Fire Your MD Now. Welcome back, ladies and gentlemen. Dr. Peter Glidden here, coming to you over the phone lines all the way from Montana. Missoula tonight, Helena, Montana tomorrow, and then Bozeman on Thursday, 7 o'clock p.m. local time. Come and join us here in Missoula at the Doubletree Riverside starting at 7 o'clock tonight. Registration is at 6:30. Get there early. We're going to pack the house tonight. Going to go right to the phones again. The phones are all lit up today. Carmel from Manitoba, way up in Canada, is calling. Carmel,
oh, yes, doctor. What would you recommend for high blood pressure? My friend has very high blood pressure.
Well, the first thing to think about is a calcium and a magnesium.
Oh, yeah.
There are two things that can cause high blood pressure frequently, besides being chased by a tiger or up in Canada being chased by a wolf, right? So it's not enough calcium, not enough magnesium, or inflammation in the blood vessels in the kidney. It's called peripheral arterial disease. So the first thing to ask, to consider, which way are we going to go, is does the person who has high blood pressure have any other problems that are associated with not enough calcium? So does the person have heartburn or insomnia or arthritis?
No, I believe that she might have a weak eyesight. She wears glasses, but other than that, her high blood pressure is very high. And what I told her, I said, stay off iron. Is that the right thing to do?
Well,
one thing to do.
Well, it's one thing to do, but it's not really going to get to the root cause of the problem. So what I would recommend that she do for 90 days as an experiment is eliminate the 10 bad foods from her diet and take one healthy start pack. How much does she weigh? Do you know?
Oh, I think she's about 160.
All right, so I would give her 2 healthy start packs a month. 2 healthy start packs a month.
Now, when you say healthy packs, is that the 91 essential?
Yeah, 90 essential nutrients. Yep, the easiest way to get that, the least expensive way to get that, the most efficient way to get that is with something that longevity calls a healthy start pack.
Okay,
there are
healthy
3
start packs.
the healthy start packs. She needs 2 of those.
2 of them, okay.
Give her 2 healthy start packs a month, and once she starts to take the supplement, have her measure her blood pressure every day.
Yeah.
And write it down.
I think she does that. She measures her blood pressure as a machine.
All right, good. So by the 4th week, there should be a noticeable, measurable improvement in her blood pressure numbers. If she does our program for 4 weeks and nothing happens at all to the blood pressure, call me back and I'll tell you what to do.
Okay. And whereabouts in Canada do you come? You say you come to Canada.
Yeah, I'm going to be up in Alberta in a couple of weeks.
That's too far. Nothing in Manitoba?
No, nothing in Manitoba for me, not anything in the near future. Dr. Wallach comes up through Manitoba frequently.
Oh, he does,
huh? What are some of the cities that are up there in Manitoba?
The biggest cities is Winnipeg. The other ones are quite a ways from here. But I would say that Winnipeg is the biggest. Pardon?
Is Regina in Manitoba?
Oh, no, that's in Saskatchewan. That's too far away.
Oh, yeah. So
that's a little smaller than Winnipeg.
Yeah, I'm going to have to check Dr. Wallach's schedule. I'm not sure, but I know that I'm not going to. But what the heck, Mary? I mean, what the heck? Carmel. Get something going up there. Get a longevity group going, and I'll come on up and lecture. What the heck?
Yeah, okay. So I'll order healthy start packs. And from Dr. Wallach or you? I have the literature.
Let me give you a number to call to place the order, okay?
Okay, good.
All right, it's 855 347
347?
Yep.
Yeah.
3696.
Okay, I'll repeat it. 855-347-3696. Okay, I'll do that.
Perfect. Give that number a call and keep your fingers crossed. And thank you so much for the call, Carmel. I appreciate it. Well, ladies and gentlemen, we are in Missoula, Montana tonight. I apologize for the crappy radio signal, but that's technology for you. If you know anyone in Missoula or in or around Missoula, have them come to the Doubletree Riverside. It's a Hilton hotel. It's beautiful. I'm looking at the river right now. Check it out. Registration at 6:30, the live event at 7. And more important than that, encourage everybody in your life to fire their MDs now. I'm Dr. Peter Glidden. Stick around. Welcome back, everybody. Dr. Peter Glidden here. 866-582-9933. That's toll free, 866-582-9933. And if you'd like, if you're listening to the podcast or would like to talk to a live human being about the health opportunity or the business opportunity, that number, 855-347-3696, 855-347-3696. Right back to the phones right now. We're going to talk to Nebraska. Diane is on the line with a question about a urinary tract infection. Thanks for calling, Diane. You are live.
Yes, hi, doctor. My husband is 67, and he had a urinary tract infection plus a sinus infection simultaneously. And they gave him antibiotic, and they also gave him vasodilator for his prostate. He took those together, and he's now finished the antibiotic. But a few days ago, he developed a strange symptom where when he urinates, he passes air.
Yeah, that's interesting, isn't it? That's a side effect of the Flomax, right? That's a side effect of the Flomax. Most probably, that's the side effect of the Flomax, the vasodilator that they gave him. So he just wants to stop that. How does he feel? I mean, has he had a follow-up urinalysis to see if the infection's gone?
No, he hasn't, but they want him to see a urologist.
Well, of course they do, and then they're going to want to, cut his prostate out, and then they're going to want to give him a fake hip, and then they're going to want to do as much as they possibly can to what he needs to do. I mean, is he symptom-free? Was he having symptoms before?
He was quite ill. He had fever, and he was feeling very badly when he went in.
And how does he feel now?
He's feeling fine. He doesn't have anything bothering him other than the fact that this air passes through after he urinates.
All right, so you want to do a Google search on the Internet for the drug that they gave him. Was it Flomax? Was it Flomax that they gave him?
I can tell you right now what it is. It's, let's see now. I'm trying to see if it's which one of these. He's on a tamsulosin. Is that the antibiotic, and he's on levofloxacin.
Yeah, okay. So do a Google search for both of those drugs and see if any of the listed side effects are that symptom.
Okay.
Now, there's a saying in medicine that when you hear hoofbeats, you think about horses and not zebras. Whenever somebody develops a new symptom, the first thing you think about is, well, what have you done differently in your life? And the only thing that he's done differently is start these drugs. Right. So 5 will get you 10. It's the drugs that cause this symptom.
Okay.
So this isn't rocket science, right? So the recommendation will be to stop the medication. That's what I would do. You might want to consult a pharmacist to see if he can just stop these medications cold turkey or whether he needs to wean off of them. You can probably just stop them cold turkey, but better safe than sorry. You should probably call a pharmacist and get some professional advice about that. And then once he's been off of the meds for 14 days, see what happens, then you should expect the symptom to go away. That's the very first thing to do. Now, remember, whenever anybody is given an antibiotic, a smart thing to do after the series of the antibiotics is finished is get on board with a probiotic supplementation.
Okay.
Because, right, the antibiotic kills the good bacteria that's in your digestive tract that you need to help digest your food. Now, you have to put that back or you're going to run into some trouble. So get a good probiotic supplement. My favorite is Youngevity's Flora FX. And Youngevity has a brand new product. It's called Root Beer Belly. It's a fascinating product. It's probiotics that are wrapped in an enteric coating which dissolves on your tongue like Pop Rocks. Remember Pop Rocks when you were a kid?
Yeah.
Well, if you put this stuff on your tongue, it tastes great. It tastes like root beer. It's an awesome probiotic, and it passes through the stomach acid unscathed and gets into the intestinal tract. It's a really great, fun way to introduce probiotics into your system. It's a brand new product by Youngevity. It's called Root Beer Belly. So get him a bunch of that and have him take it for 7 or 14 days. Get off of the meds, keep your fingers crossed, and see what happens.
Okay, thank you.
All right, hey, thanks for the call. Call me back. This is a really interesting symptom. I'd really love to know what happens. So either way, give me a call back with a heads up. Sound good?
Okay, thank you.
All right. Thank you so much for the call. So last night, I'm talking to 75 people in Kalispell, Montana, right up next to Flathead Lake. Beautiful up there, by the way. And we got a lot of questions. We always get a lot of questions because people are concerned and, you know, a little bit of knowledge is a bad thing. People go on the Internet. They'll listen to Dr. Oz. They'll listen to somebody who says something about something, and they get it in their mind that this particular thing is so, even though it might not necessarily be so. I got a question last night. This woman's been on Youngevity for 3 months. Her blood pressure is better. Her arthritis is better. She's sleeping through the night. Her heartburn is gone. She's well on the road to recovery. She feels great into the bargain. But she said, I just can't get my cholesterol down no matter what I do. And I've tried everything to get my cholesterol down. I said, well, how high is your cholesterol? She said, 259. I said, what's your race? She said, I'm Caucasian. I said, how old are you? She said, I'm 65. I said, well, the research clearly shows that postmenopausal white women do better with total cholesterol numbers over 300. And, you know, her jaw dropped. And she said, you've got to be kidding. I said, no, that's what the research shows. The total cholesterol levels for postmenopausal white women over 300 are to be promoted. you don't have a problem with high cholesterol. The only person that thinks you have a problem with high cholesterol are the people selling you the cholesterol meds, and they're wrong. You've been played by the drug companies. So I love to see total cholesterol levels in everybody be around 220. If you're a postmenopausal white woman, I like to see it be over 250. And quite frankly, over 300 if you can ever do that. That's not the easiest thing in the world to do, given the culture that we live in, which is fat-phobic, right? Fat is the Antichrist. Butter is the Antichrist. You have to exercise all of the time, and it's all nonsense. We recommend a diet that's high in good fats, a diet that's high in butter, a diet that uses salt liberally. We recommend these things. And when you do these things, guess what? Your cholesterol levels will come up a little bit, they'll come up a little bit, they'll come up a little bit. Your sex hormone production gets better. Your central nervous system gets healthier. All around, you feel better. And the only person that are going to tell you that that's wrong are referencing research that's outdated, old-fashioned, and quite frankly, corrupt. Ladies and gentlemen, health, you're welcome to your own opinion, but you're not welcome to your own set of facts. And quite frankly, when it comes to cholesterol, we have all been played, which is why next week I am going to devote the entire week to heart disease and especially this whole conversation about cholesterol. That's next week on Fire Your MD Now live, Fire Your MD Now. Please visit the website of the same name, fireyourmdnow.com. We're going right to Florida now. Javi is calling up with a question about a stingray, I think. This should be interesting. Hello, Javi. Yes. Welcome aboard to our live.
Hi. Hello, Dr. Glidden. Yeah, I went to the beach 2 weeks ago, and I got stung by a stingray.
Yeah.
The pain went away in about 2 hours. I put in hot water. I did all I should have done. And now, 2 weeks later, I think it seems like I'm getting an infection because I have a little bit of swollen area, and it hurts to the touch, and it's kind of red and hot. What can I do?
All right, so the best thing to do for a puncture wound like that is get some colloidal silver and spray it on the wound 3 or 4 times a day. And when you go to sleep at night, soak a gauze pad in colloidal silver and tape it right over the wound. Okay, colloidal silver is antimicrobial. It will help secondary infections from developing and will speed up recovery time, number one. Number two, there's a homeopathic medicine that is almost specific for puncture wounds by animals. It's called in now. Homeopathic medicines are all named in Latin names. So first I'm going to say it, and then I'll spell it, especially since we have such a crappy connection today. So I want you to go to a health food store or go to a Whole Foods and pick up a homeopathic medicine called Apis mellifica. You spell that A like apple, P like Peter, I like India, S like Sam. A-P-I-S, second word, M like Mary, E like Edward, L like Larry, L like Larry, I like Indigo, F like Frank, E like Edward, L like Larry, L like Larry, I like Indigo, C like Charlie, A like Apple. Apis mellifica. 30C. Take 2 pellets of the Apis mellifica 4 times a day for 2 days. If there's absolutely no change after you do that, switch to a different homeopathic medicine called Glidden. L like Larry, E like Edward, D like David, U like Undergod, M like Mary. Glidden. Take 2 pellets 4 times a day for 2 days. Either the Apis or the Glidden most assuredly will stimulate your body to bring it back to the recovery trail if you're experiencing a puncture wound from an animal. Homeopathy in this regard is really a fantastic thing, Abby, and so give it a try.
Okay, thank you.
All right, buddy, sounds good. Thank you for everything that you did. That's the first stingray question I've ever got, ladies and gentlemen. This is the power of the Longevity Network. We are generating a grassroots coalition of the informed, and it is an awesome thing. Dave, from Nevada, I think, is calling up with a question about joint health. Dave, we've got a couple minutes left. How can I help?
Started following Dr. Wallach's advice about 8 months ago for joint pain and back problems that I've had for like 50 years. And it seemed impossible what he said, that you could actually regain lost height. But I have. And I'm astounded. And, of course, nobody believes it, but when I was about 20, I was 6'2" exactly, and I gradually shrunk to about just over 6 feet. And now I've measured quite accurately, and I'm like 6'1", maybe 6'1" and 1/8. And I'm just wondering, can I hope to regain all of that height?
Well, time will tell, and here's the deal, Dave, right? Well, as God is my witness, I used to think I knew where the body's point of no return was before I met Dr. Wallach, because, I had, 15 years of clinical experience under my belt, and my you-know-what didn't stink, right, because I got good results. But I tell you what, since I've been with Wallach and since I've been using his protocols and his methodology, the things that I've seen people recover from, like this, completely blow my mind all the time. So, hey, man, sky's the limit. What you can expect is 100% optimal health. So just stay the course, maintain the discipline, and your body will fix itself to the ability that is able to fix itself. Welcome back, ladies and gentlemen. Dr. Peterson here. We're going to end up this segment, and then because of the poor signal quality, we're going to go to a pre-recorded segment for the next hour. I apologize. This is the trouble of being a road warrior. You have to take what you can get when you end up at your destination. In any event, tonight, Missoula, Montana, 7 p.m., the live lecture starts. Tomorrow night, Helena, Montana, 6:30 p.m. registration, 7 p.m. the live lecture starts, and we're ending it up on Thursday night in Bozeman, Montana. Bozeman, Montana on Thursday night. Spread the word. Go to my website for event locations and details, and numbers that you can call to register for a seat. The seats are free, but there's only so many in the room, and last night we maxed out. If you have someone in your life that lives in Montana, let them know what we are up to. Visit fireyourmdnow.com for location information, specific location information. Hope to see you there. Now, I get lots of questions at these live events, really good questions. And one of the things that people have been enrolled in is this notion that there exists such a thing as an autoimmune disease. People will tell me, oh, I have an autoimmune disease. My doctor tells me that my condition is autoimmune. My doctor tells me my condition is genetic. And then when people, and those are two different things, by the way, but when doctors use those two phrases, it's autoimmune or it's genetic, all of a sudden we feel intellectually inferior and we shrink back from what the doctor is saying and we just believe that it's so when in point of fact it's not. Autoimmune diseases, we believe, to be a complete misinterpretation of what's happening inside the body, because MDs always come late to the party and they have no ideation at all of what medical nutrition is or how the body degenerates in the first place. They think that it's all just happenstance and chance and, a biochemical smorgasbord and who knows what's going to happen. It's nonsense. They don't really have any firm ground to stand on, so they keep shifting their point of view all of the time. First they tell us it's genetic, and then they say, oh, it's not genetic, it's epigenetic. And then they tell us, oh, it's not epigenetic, it's autoimmune, and it's nonsense. Some doctor from Harvard says that it's an autoimmune disease, and 100 of his students say that it's an autoimmune disease, and then the message populates through the medical community that it's an autoimmune disease, and nobody questions it. Everybody just goes along for the ride, and because it is one big boys and girls club, just like the Senate. Once you're in there, nothing bad's going to happen to you, and everybody's got your back. Or like the police department, they're never going to give up one of their own, right? There's the blue wall that you can't get beyond. It's the same in medicine. Somebody says something, everybody accepts it as gospel, even though it's not so. Autoimmune diseases, from our point of view, go like this. The body is chronically undernutrified. The body does not have the stuff it needs to maintain its health. And the person is unwittingly eating all of the wrong food all of the time. So this creates inflammation. So there's inflammation all of the time somewhere in the body, and the body doesn't have the raw materials to fix it. So eventually, those chickens come home to roost, the body gets inflamed, and tissue gets destroyed, and there's inflammation and tissue destruction, and inflammation and tissue destruction. And after a while, there's so much inflammation and tissue destruction that the immune system freaks out and goes in and tries to fix it. And the antibodies that MDs see present in someone who they characterize with an autoimmune disease, we believe, are caused by the disease. It's the body's attempt to fix it. The MD believes it's the antibody that caused it because they came late to the party. And these are two diametrically opposed points of view. It's one or the other. It's either, the sun that's at the center of the solar system or the earth that's at the center of the solar system. It can't be both. It's got to be one or the other. Now, who are you going to trust, the MDs, or are you going to trust us? Well, if you just go by their track record, if you trust them, you've got your head in the sand and you're going to be let down, which is why we recommend everybody listening to this program immediately fire your MD now. I'm Dr. Peter Glidden. Hope to see you tonight in Missoula, tomorrow in Helena, and Thursday in Bozeman. I'll catch you tomorrow. Hopefully we have a better signal. I'm Dr. Peter Glidden. Over and out.